Listen to that. Does that sound familiar? Maybe you don't hear it with your ears, but you certainly feel it. That is the sensation of bone on bone. That is your femur grinding into your tibia because the cartilage, the smooth Teflon coating that used to be there, is gone. Every step you take is just friction, heat, inflammation. Most doctors will tell you you have arthritis. Here's a painkiller, come back when you are ready for a metal knee. Or they send you to physical therapy to do leg lifts. But think about it. If your car tires are rubbing against the fender, does driving faster fix the problem? No. You need to create space. You don't need stronger muscles yet. You need to pull the fender away from the tire. Today, I am going to show you the one move. It's not an exercise, it is a decompression technique. We are going to physically pull your bones apart just a few millimeters, and in that tiny gap, magic happens. The pain stops instantly. Put away the painkillers, go get a thick bath towel. I'm Robert, let's open the gap. Before we do the move, you need to understand why you are in pain, so you don't undo the fix the moment you stand up. Look at this knee model. Your knee is a hinge, but it is also a vacuum seal. Inside the joint capsule, there is a fluid called synovial fluid. It's like the finest oil in the world. It feeds the cartilage, it lubricates the movement. But here is the problem: gravity. You have been standing on these knees for 50, 60, 70 years. Gravity is constantly pushing the top bone down into the bottom bone. Over time, the muscles get tight and short. They act like clamps, permanently squeezing the fluid out. When there is no fluid, the joint becomes a dry desert. That's the stiffness you feel in the morning. The move we are about to do uses a technique called long-axis traction. We're going to reverse gravity. We're going to create a negative pressure inside the joint, a vacuum, and that vacuum will suck the synovial fluid back into the center of the joint where it belongs. It's like turning a dry sponge into a wet sponge. But first, we need a baseline. I want you to provoke your pain gently so we can see if the move works. Test 1. The deep bend. Stand holding a chair. Bend your knees as far as you can go comfortably. Note the point where the pain starts. Is it at 45 degrees, 90 degrees? Remember that feeling. Give it a number from 1 to 10. Test 2, the step down. Find a stair or just a thick book. Step up with your good leg and lower your bad leg down slowly. Does it hurt right under the kneecap? That is patellofemoral compression. The kneecap is grinding. Okay, you have your number? Let's say it's a 7 tens. Our goal is to get that down to a 3 tens in the next 2 minutes. Sit on a high chair or a table. Your feet must be dangling, not touching the floor. This is critical. Here is the protocol. Follow exactly. We are going to use the towel as a fulcrum to pry the joint open. Step 1. The setup. Take your bath towel, fold it or roll it up so it is thick, like a log. Place the towel directly behind your knee joint in the popliteal fossa. Tuck it in deep. Now grab your shin, the lower leg, with both hands. Step 2. The squeeze, the fulcrum. I want you to pull your shin backward, bending your knee as much as you can over the towel. Think of cracking a walnut with a nutcracker. The towel is the walnut. Squeeze. You might feel a stretch in the thigh. That's okay. This creates space in the front of the joint. Step 3. The traction, the release. Now, relax the squeeze slightly. Interlace your fingers around the front of your ankle. Let your leg go completely dead weight, heavy. Lean your body weight back. Let the weight of your leg and the pull of your arms drag the lower leg bone, the tibia, away from the thigh bone, femur. Imagine you're trying to pull your leg out of the socket gently. Hold. Close your eyes. Visualize the space opening up inside the knee. Visualize fresh, cool water rushing into that hot, dry joint. Hold this traction for 20 to 30 seconds. Breathe.
Don't tense up. If you tense your muscles, you fight the traction. You must surrender to gravity.
Now don't stand up yet. Depending on where your pain is, we need to micro-adjust. Knee pain is rarely right in the middle. It's usually on the inside, medial, or the outside, lateral. Variation A, for inside pain, medial. If your pain is on the side where your knees touch, while you are pulling the leg down, traction, I want you to gently rotate your toes inward, pigeon-toed. Then pull. This opens up the medial compartment specifically. Variation B, for outside pain, lateral. If your pain is on the outer side, rotate your toes outward slightly while you pull. This targets the lateral meniscus and cartilage. Do 3 rounds of this. Traction, 20 seconds, release, and wiggle. Traction with rotation, 20 seconds, release. There is one more piece of the puzzle, the kneecap. Often the knee joint is fine, but the kneecap is stuck like a rusty gear. It's glued down. While your leg is still dangling and relaxed, take the web of your hand between thumb and pointer finger, place it on top of your kneecap. Gently push the kneecap down towards your toes. Then use your fingers to pull it up towards your hip. Then push it left, then right. It should glide smoothly. If it feels crunchy or stuck, that's a problem. Gently mobilize it, up, down, left, right, like you were loosening a jar lid. This sends a signal to the brain. It is safe to move.
Okay, the moment of truth. Remove the towel, put your foot on the floor, stand up slowly. Do you feel that? Your leg feels longer, lighter, maybe a bit unstable? That's normal. You just stretched the ligaments. Now, try the deep bend again. Go down. Did the pinching stop? Did the sandpaper noise get quieter? If you went from a 7/10 pain to a 3/10, that is a victory. You just proved that your knee isn't broken. It was just compressed.
But Robert, gravity will just compress it again in an hour. Yes, unless you build the pillars to hold the roof up. You cannot live on traction alone. Traction is the emergency relief. Strength is the permanent cure, but you cannot strengthen a grinding joint. So here is your new protocol. Decompress first. Do the towel move every morning and every evening, especially after a long walk. Isometrics second. Once the pain is down, do the invisible chair hold. Use the muscles to hold the space you just created. And finally, what is that fluid made of? Water and collagen. If you are dehydrated and if you are not eating the building blocks of cartilage, you can pull in your leg all day, but the joint will remain dry. I want you to consider adding bone broth or a high-quality hydrolyzed collagen supplement to your morning routine. Think of it as the grease for the hinge. The towel move opens the door. The collagen oils the hinge. The muscle moves the door. You need all 3. Pain is noisy. It screams at you. But relief is quiet. When you stand up after this move and feel nothing, that is the most beautiful feeling in the world. Don't let anyone tell you that bone on bone is a life sentence. It's just a mechanics problem, and we just fixed the mechanics. If this gave you relief, hit the subscribe button and share this with that friend who is always limping. You might save them from surgery. I'm Robert. Keep the gap open.